Let's go over the NCLEX question of the day. So, a client diagnosed with a head injury undergoes preparation for a lumbar puncture. Which action will the nurse take first? First of all, let's figure out what we're talking about. What is a lumbar puncture? It's where they take a needle and they insert it in between the spine, the vertebrae, to get cerebral spinal fluid to test for infection or culture, whatever else. So here's your options: obtain informed consent, measure pre-procedure vital signs, explain the procedure to the client, and locate a lumbar puncture tray. So option number one, obtain informed consent. As a nurse, do you obtain informed consent? Is that your responsibility? No. It's the provider's responsibility to get that informed consent. Measure pre-procedure vital signs. Is this something you would do? Yes, it is something you would do. Explain the procedure to client. Is this something you would do? You could. The provider is more likely to explain it. They know more about it, but you can answer any questions that they might have. Locate a lumbar puncture tray. You also might do this, but does it take priority over explaining the procedure and measuring the vital signs? No. In the NCLEX, the right answer is almost always never going to be to leave the patient and go look for something else. So let's go to our two options that we have: explaining the procedure and measuring pre-procedure vital signs. So which one of these are more important? Usually it's going to be assessing your patient. So if you measure pre-procedure vital signs, don't forget your patient has a head injury. If their respirations go up, if their pulse goes down, and if they have widening pulse pressures, which means that their systolic is super high and their diastolic is low, this is a Cushing's response to increased intracranial pressure, which is a contraindication to a lumbar puncture. So at that point, you wouldn't even need to explain the procedure because the patient won't be able to get it anyways. Just so you can see, pre-procedure vital signs is correct. You always need to assess your patient. Usually the answer is never going to be to leave your patient to go look for something or get something.